Okay, guys, for B, we're discussing palliative care information. So here we go. Core idea from the surrounding page. The text reflects a central dilemma in palliative care. While modern medical ethics often emphasize full disclosure of diagnosis, prognosis, and treatment options, not every patient wants or benefits from knowing everything. The surrounding page situates this issue within a broader debates about patient autonomy, cultural validation, and the relational nature of decision making. It highlights how interdisciplinary perspectives, psychology, anthropology, medicine, coverage to show that less information can sometimes be the most compassionate, patient-centered approach. Why not knowing everything can be valid and ethical. Autonomy as choice, not overload. Autonomy is not synonymous with receiving every possible fact. It means patients have the right to decide how much information they want, whether that's full disclosure, partial, summaries, or delegating details to someone they trust. Respecting limited disclosure can be just as ethical as full transparency. Dynamic preferences. Patients may change their minds, initially requesting full details, then later asking for less. This evolution often reflects coping needs, emotional fatigue, or shifting priorities. Clinicians must remain attentive to these changes without assuming inconsistency equals incapacity. Cultural and relational dimensions. In some cultures, families act as gatekeepers of information, shielding patients from addressing details. In others, collective decision making is the norm. Recognizing these frameworks prevents clinicians from imposing Western style disclosure standards that may feel alien or harmful. Psychological protection. Choosing not to know everything can be a coping mechanism, allowing patients to focus on comfort, relationships, or spiritual preparation rather than medical minutes. Give me 1 second, folks. Practical communication strategies highlighted. Ask, tell, ask, cycle. Begin by asking patients how much they want to know. Provide information tailored to that preference. Then check back to ensure understanding and emotional alignment. Graded disclosure. Instead of overwhelming patients with technical detail, offer broad outlines, key milestones, or big pictures, summaries. This helps patients retain agency without drowning in data. Information proxies. Patients may delegate a family member or caregiver to receive full details. Clinicians should confirm this delegation explicitly and document it to avoid confusion. Periodic reassessments. Preferences are not statistic. Teams should revisit disclosure choices regularly, especially after clinical changes, ensuring communication remains aligned with the patient's evolving needs. Essential versus optional. Information. Patients must still understand enough to make meaningful decisions, e.g., risks, burdens, alternatives, but they need not to be burdened with every technical detail unless they request it. Ethical guardrails for clinicians. Validate and clarify. Explore why the patient prefers limited information. Confirm they understand the implications and ensure they retain decision-making capacity. Avoid collusion. Families sometimes request that clinicians withhold information unless the patient has explicitly directed this, since risks undermining Trust. Clinicians must seek the patient's consent before limiting disclosure. Document thoroughly, recording preferences, rationalities, and designated proxies ensures team consistency and protects against ethical and legal disputes. Quality of life as the guiding principle. The ultimate aim of palliative care is not information transfer, but alleviating suffering and supporting what matters most to the patient. What this means in practice: patient-centered communication. The measure of good care is not how much information is shared, but how well communication aligns with the patient's coping style, cultural background, and values. Interdisciplinary collaboration. Psychologists, anthropologists, nurses, and physicians, each being insights into how patients process information and how families negotiate disclosure together. They create strategies that avoid rigid one-size-fits-all norms. Quality of life framing. Conversations focus on comfort, trade-offs, and priorities rather than exhaustive medical detail. This ensures care remains humane, ethical, and responsive to the patient's lived reality. Bottom line: in palliative care, not knowing everything can be legitimate, ethical choice. When patients explicitly state their preferences, when those preferences are revisited and documented, and when clinicians balance essential disclosure with respect for cultural and personal coping styles, limited information becomes not a failure of transparency, but a form of compassionate, patient-centered care. Okay, guys. So that is your B today. I will see everybody Monday for shows. Until then, Gator Wellness. Take care, folks. Have a good rest of the weekend.